probably our last one shooting here live from Medicarians, probably our final episode. And again, as always, really appreciate your time. Excited to have another guest.
Bringing out the big guns.
Yeah, I've been able to have some really great content here. So, George, why don't you go ahead and start us off and introduce yourself?
Hi, folks. I'm George Kalogeropoulos, co-founder and CEO of HealthSherpa. We do ACA Enrollment solutions.
Yeah, I think anybody in the industry probably is familiar with your company. Any agent who does not live under a rock probably uses your platform and product. For any agent out there who's in the ACA space or the IFP space, and writing your, obviously you guys do more enrollments than even CMS, correct?
As of plan year 24, that's certain. For 25, depends on how you count all the ones that hit invalid action.
Yeah.
That's a thing these days.
I'd like to, HealthSherpa is interesting. I'd like to kind of go back a little bit. How did you get into the health tech space in the beginning, and take us back to your early days and the origin briefly on HealthSherpa?
Sure. Well, and the key word there is briefly, because it's kind of a long and convoluted story. But
I like some forks in the road every once in a while. But go ahead.
Well, it's been all forks. So, HealthSherpa actually started out as a real estate data analytics company called Rent Metrics.
Okay.
Back in 2012.
That's a pivot.
It's quite the pivot. Well, it turns out that real estate investors, that's why actually our corporate name is geozoning.
I did notice that.
Yeah, really?
Yeah, on contracts that you signed.
I've never noticed that.
I'm the George, the geo, and we thought we were being very clever because it was in real estate, so geozoning. But what ended up happening was, it turns out real estate investors are not hugely into, or at least back then weren't hugely into data or analytics. I think really for us, the death knell for that business was, I remember presenting to Senior Vice President of Investing at a very large real estate fund with something like $10 billion under management. And I told him what we do. And I said, well, we have this statistical model that helps you accurately price residential rentals. That's what we were doing. And he goes, George, if I took a statistical model into an investment committee meeting, I would be laughed out of the room. And that's when I said, we are in the wrong line of business. Like, what else can we do?
Yeah.
And so that's when we started running experiments in sort of, the thesis was, real estate's this large industry where there's like a lack of price transparency, and we could use data and analytics to solve that. What else looks like that? And we're like, well, healthcare. And we were so naive. We didn't know what we didn't know back then. But we saw that, no one knows what a hospital visit costs, right? So we tried to do price transparency before price transparency was a thing. What we discovered there was that everyone wants that data. So every payer and every provider will rapidly consume that data. None of them want to share that about themselves.
I was going to say that. It's still a problem, transparency.
Well, and I was like, well, if given that dynamic, there isn't really a business here either. And so we started running experiments. And one of the experiments we ran, I still remember this. We had this whiteboard with 10 different ideas in healthcare. And the one we thought was going to work was marketing websites for ambulatory surgery centers. Completely unrelated. So, and number 4 was, I remember it was betterhealthcare.gov ? This was right when it launched. And so we slapped together a quick prototype, and it's funny, it literally took a day and a half. And that was all it took for there's huge, interest in that. We had 1.5 million visitors the first month to that property, and we're like, okay.
Whoa. What year was that?
2014.
Okay.
So we're clearly there's demand. So we got to figure this out. And of course, to your point about forks in the road, we iterated through 7 or 8 different business models before hitting the one that that works today, and the one we're able to to operate. And so it's been a quite long and windy but fun road.
I was going to say, but that's always the challenge, right? You have a great idea, and then it's figuring out how to monetize it and that monetization model, right?
Well, it's interesting too that it was real estate to insurance, because Dan's joke is, we got into insurance because we failed at real estate, or
Same here.
Failed realtors end up transitioning over to be the insurance agent,
That's exactly our story.
Or last chance millionaires, we call them.
Yes, exactly. Yeah.
Well, not real estate, but maybe health insurance. So yeah, here we are.
Yeah.
So then you guys just really took off and became the platform for the ACA enrollments.
Well, I think what we probably realized so we spent 4 or 5 years trying to build a better consumer enrollment experience. And so, because we, every naive Silicon Valley startup, no offense to anyone who's listening, but thinks it's you just need to make the buttons prettier and the workflow easier and people will figure it out. Well, it turns out when you look at who is ACA eligible, and in this country, there's a very strong correlation between income and literacy. So many of the people who enroll in health insurance and the ACA may not have English as their first language, or if they are literate, they read at the 3rd or 4th grade level. So saying to them, I need you to understand copays, co-insurance, deductibles, out-of-pocket maximums, networks, formularies. And when you figure that out, let's talk advanced premium tax credits and cost sharing reductions and all these things that are second nature to us, but like foreign and alien to your typical low-income consumer. Like, it's obvious to brokers. It was not obvious to the market as a whole, and I think even to carriers and the administration at the time. But I think we spent so much time like rounding out the button and making it pop a little more, and people just couldn't get through. And then we're like, who keeps getting people through no matter what? It seems to be brokers. So why don't we just forget the serving consumers? We're just going to go straight and say, how do we make the broker more productive? How do we make their lives easier? How do we give them technology that makes it work? And that was like the turning point for us.
I would imagine that. I mean, obviously, every year too, you guys have the pace that you go is actually very impressive. Like I would say, with your team, you look at the platform and the capabilities and the iterations, and it's like every year you guys have a really strong sprint or like a roadmap for all of your initiatives. And I see that at least 2 to 3 major milestones every single year. Does that seem about accurate?
Yeah, I mean, that's kind of you to say, and I'm glad you know this, because we put a lot of, I think it's one of the benefits that comes from focus. Like, we specialize in basically making brokers more productive and enrolling in ACA and now Medicare. And so that's all we do all day is sit and watch brokers click through the experience, figure out where their things are breaking down, react to CMS-driven changes, and so on and so forth.
And I think that's one of the things. I mean, we're obviously, we just met off camera with, some of your staff members, and we were having that conversation. One of the things that we really like is that your team is diving into understanding the industry and not just, hey, this tech platform or the consumer.
Yep.
It's understanding like the time that they're spending to have conversations with the carriers or the payers that are creating these products and their pain points and what's happening in their world and what is happening to the broker and the consumer, and even understanding the distribution model and the pain points, because you guys are right at the center of it, kind of connecting all the dots, so to speak. And that is the one thing that I have been impressed with, is trying to understand that from a better perspective and solve it.
I appreciate that. I would say the technology that we deploy, and fundamentally, like when you think about the sort of the spectrum of, it's not rocket science, right? It's what you call a CRUD, create, records, update, delete, right? App. And so at its core, what really matters is the detail, is how much you figure out every possible use case, every possible challenge, and really optimize that for the broker. So we like to say, like, we were focused on brokers as our prime constituency and making them happy and productive before it was cool. Mm-hmm. I think now a few folks have sort of caught up that it's the success of the ACA and Medicare is broker driven.
Yep.
But I think we were a little earlier to that realization, at least from the sort of technology world. I mean, brokers knew all along, but yeah. Yep. So that connection has always been a core part of our DNA.
Yeah, and we explain that to people a lot, obviously, from our side, or our part of the supply chain is just, and you touched on it a little bit, is how nuanced health insurance is, whether it's health insurance or Medicare, whatever that is. It's not like selling an easy product. Like, you're not selling them a TV and you're going through like the resolution or a couple of specs. It's very complicated, unfortunately. And, and it's a challenge to kind of take something that's very nuanced with a lot of different key terminology and explain that in a way that the consumer understands what they're getting. And so it's one of those things that we very much appreciate, your understanding it. We think that the broker is always going to play a very valuable part in the healthcare model, even as we have evolving technology and better quoting systems and better AI and better everything else. There are some limitations, and I think there's always going to be some of that human broker element involved in the process.
Yeah, and so what I love to point out on this front is, not to call anyone out, but I had someone from the then Obama administration say to me in 2015 that, brokers are travel agents and we're building Expedia. And I said, well, that's interesting, because I don't know that the government built Expedia, but also like that fundamentally sort of states what the complexity of the product. And so sure enough, in 2015, brokers were 42% of FFM enrollment. And I think as of at least Pioneer 24, it was closer to 80%.
Wow.
Right? And so it's exactly the opposite of this narrative people had constructed that technology was somehow going to supplant brokers, when in fact technology is a tool that brokers use, like the most effective brokers use, to be efficient. And yes.
I think that's a really apropos conversation right now, because, I mean, even if you just look around the vendor floor, much of the conversation and a lot of the tech industry is driven around AI.
Yep.
And there's a lot of consternation and maybe worry from agents and, you know, even FMOs like ourselves of going, it seems like all these people are trying to build technologies and platforms to replace what brokers do. But I like how you said it, which it'll really augment and make the broker more effective and more efficient.
Yeah, and I would say the experience of learning that lesson the hard way with, you know, empowering brokers has made it a lot easier to approach AI. Like we use a lot of AI at HealthSherpa, but it's always in a supporting role to like, we don't like replace programmers with it because, by the way, if you have AI write your whole code base, nobody in your organization understands your code base.
Right.
So that's a problem. So it's always an augmenting function. And so I think, you know, there's a very powerful role for AI to play in making this more efficient, but it's making us more efficient. It's not replacing us.
Yeah, and I would also say, like, you guys have figured it out from the perspective of like who is your customer, who is your audience, right? And that pivot from we're going to pivot from the consumer to being the broker or the agent. That's our customer, that's our audience, and that's one of the things that ultimately some payers or carriers in the ecosystem and even, you know, HHS or CMS, they don't figure out that they're always thinking about that end user, that consumer, but they don't understand that the person that they need to kind of change their practices, policies, you know, and provide some assistance with is actually the agent who is conducting that point of sale transaction. You know?
Well, I'd say, I mean, to be fair, it's changed a lot over the years, right? There was a time when I think regulators didn't understand or appreciate the role of agencies or FMOs at all.
Yeah.
And now, you know, you have contacts there. There are people you know and talk to. And so they've come a long way from where it was. But I think you're right. Like, still, like, you kind of have to see it to understand how incredibly powerful and capable brokers are in terms of actually getting to people and getting them enrolled. Like that, like it seems like on paper, it seems like, oh yeah, just make a better website. Oh yeah, spend a couple $100 million on marketing. Like none of that works. What works is someone who is like on the ground or knows the person, talks to them, understands them, addresses their needs, knows how to get them enrolled, how to meet their objections. Like there's no substitute for that.
Yep. And so kind of I want to rewind it a little bit and thinking about your whole path from 2012 till now, 13 years, this journey. Yeah, you know, and I think as a business owner, I have all these challenges and I'm always grappling with a couple issues and I'm trying to overcome. Is there anything in the journey that has been really challenging? What was like your biggest challenge that you were able to solve over these last 13 years?
So I would say the biggest challenge has been what we call innovation at scale. So it's very easy as a small startup and you have like brilliant team members as we have, you know, to like really crank things out quickly. But then when you try and do that with 10, 50, 100, 150 people involved, it's a very different problem and a very different process to get there. And a lot of companies actually never really make that transition.
I agree.
And so they end up stuck with like something someone built 10 years ago and they're iterating on that. And we've been very fortunate. We have some just wonderful people at the organization who like have just figured it out. And now we can sort of add folks to the teams and create more products to the standard we want at the speed we want.
I think that's really important. And for you as a CEO, dealing with, you know, government oversight and regulation like CMS, it must feel a little bit, especially over the past 2 years, like a cat chasing one of those laser pens, you know, where you're always being asked to move around, and you've had to do a great job of being very reactive, solving problems, continuing to kind of react to forces that were outside of your control. What's that been like over the past, you know, couple of years?
It's had its share of challenges, but I think it's important to recognize the intent that like the folks at CMS have always, you know, they've always had the best interests of the consumer and the market at heart, just like brokers have the best interests of the consumer at heart. Like, so we're very aligned on that. I think in some ways we speak different languages, and in some ways there are different perspectives and different considerations that have to be taken into account. So it's certainly, there has been a lot of reacting to change, but you know, I would say I would commend the folks at CMS for trying, and the pace at which and the way that they've managed the very different stakeholders and pressures that they face. Because I think in our world, we don't see a lot of what it is to be a career civil servant, a career person in government, and to have, you know, the threat of Congress investigating you, and to have, you know, angry senators writing you letters, and to have people threatening to sue you. And like, these are...
That doesn't ever happen to you, does it?
On occasion, but not. But fortunately for us, we don't work for the government, so
Yeah.
we're not quite as vulnerable.
No, but I would imagine it's very different than what people probably perceive. That you have, I would imagine, very constructive conversations with CMS, and you have a seat at the table, so to speak, in trying to be a part of the solution and in a very, cohesive manner.
What's it been like, with the transition of CMS? Or do you feel like you have a good source of communication right now? Is there mutual communication going on with this new administration? And are you having productive dialogue on some of the changes that are taking place?
Yeah, so I would say CMS is very, with good reason, is very, very strict about ensuring that there are no back channels. There are front doors through which everyone can go. And I think the folks we talk to are many of the same folks that agents talk to and other technology platforms talk to. In general, communication has been good. With every administration shift, there is always a little bit of just procedural uncertainty because, frankly, you're waiting for the new political appointees to get into their seats, and you don't want to overreach before they're there. And so there's been a slight interruption.
A lull, yeah.
A lull, a lull is a great way to describe it. And then, of course, we're starting to see some of the new administration's policies be shared and start to take effect.
Yeah, and I think we're going to start to see a pretty clear picture of direction and directive, and we're going to start reading between the tea leaves here pretty soon in the coming weeks, right? Yeah. And the other thing I would just say, and I want your perspective on this too, is, we really only got into the ACA space about 3 years ago, and I felt like, and I don't have all the context that you do in the industry for a long length of time, but I do feel like just the amount of change was just so rapid for the last couple of years. It became very hard, to your point, like from a larger organization to be nimble and to pivot and adapt. That has definitely been a struggle over the last couple of years. Is it accurate to say that there's been a lot more change happening at a much faster pace these last 2 or 3 years than the previous 10?
No, actually.
It was perfect. I want to hear this perspective.
It's funny because we sort of hear folks reacting to some of the changes that are being proposed now, and it's like, you got to remember, in 2016, the country was all but certain that the ACA was going to be repealed and replaced.
Yeah. Right.
And so we went through that cycle.
That was a whole campaign, repeal and replace, right?
Correct. It was a campaign promise. And then, there were 3 legislative attempts to do that. And at the same time, you had carriers pulling out of the market.
Yep.
And so it was an extremely volatile time. I mean, we experienced, I remember one year there was like an 80% reduction in enrollment volume.
Those co-ops were all failing.
The co-ops were failing at the same time. So it's it's always been a roller coaster, is what I'd say.
So you've always had to continue to pivot your business model and adapt to the changes and the revenue into the business in reaction to a lot of these changes.
Correct. It's always been like this.
In regards to a couple specific things right now, I mean, a lot of ACA brokers right now are very concerned about the possible elimination of the SEP for the 150% of the FPL.
Yeah.
What do you think, if you want to suppose what's going to happen there, and how is HealthSherpa prepared to, adapt to significant changes like that?
Yes, excellent question. So, I will say, going back to your question about how things were before, in 2021, we first experienced this year-round open enrollment where SEP was the same size as open enrollment. Before that, it hadn't been that way. And I think we expect things to revert to pre-21, pre-COVID, response.
Yep.
Where SEP is substantially smaller than open enrollment. And that's actually just that is how the market was designed to operate. So I know it's causing some concern if the only world you've seen is one in which SEP is the same size as OEP or bigger. But historically that hasn't been the case. And I think we're going to see a reversion to that trend, because at the end of the day, SEP 150 was a response to a Medicaid unwinding. It was a response to COVID, and those things have run their course. And so I believe the policy perspective is it is appropriate to sort of return
to normal, so to speak.
Yes. But it's a different norm.
Yeah. But I would also say the other thing I'm actually in favor of, I already saw that they were proposing to shorten OE and dial that back. And it has been a little bit messy to have a longer OE period at the end of the year. And then you have a lot of policies that are going into effect February 1st, which is also a challenge because with health insurance, people are, stacking or getting their co-payments. They're trying to hit their max out-of-pockets. It's harder with the start date on 2/1 instead of 1/1. So I would actually say there's been some concern in our industry about having a shortened window for open enrollment, but I'm candidly okay with it, if I'm being honest.
It's interesting. I'm not. I mean, I think we would appreciate a longer open enrollment only because when you think about the number of people who try and do both ACA and Medicare,
correct,
having those two deadlines so close to each other is just a real challenge operationally.
It is a challenge, and even a consideration would be then, maybe extending the open enrollment period earlier on, maybe creeping into October, even though it overlaps with Medicare, and I know that. But I like the start date of being a 1/1. But you're right. There's only so many hours in a day, and so many people that a broker or an entity can go help. And even the folks at CMS. I mean, sometimes those wait times are really brutal because there's only so many hours in the day.
Yeah, I think if I look in my crystal ball and see kind of what's happening with, and even talking to a lot of the agents here, I'm seeing a lot of agents that are great agents are in ACA, and they're kind of seeing maybe the window shortening or the opportunity year round, and they're looking at alternative opportunities. And so I think a great ACA agent is now considering Medicare as well, and some ancillary products as well. And we've seen that kind of in reverse as well. As things got hard on the Medicare side of things over the past 5 years, we saw a lot of those other agents entering in the ACA space. So I think you're going to see more of an evolution of a sophisticated agent that's doing both and ancillary. And there's probably going to be a less number of agents in the overall ecosystem, but they're going to be more sophisticated and more educated on both sides.
More productive.
Yeah, I would agree. I think the best agents, I mean, have nothing to worry about because they adapt and overcome. But I would say I think you're right about how the market will evolve, and we're going to see an emphasis on eventually other products as well, and other ways to meet the same underlying need that folks have.
And obviously that's kind of on your guys' roadmap, obviously being able to expand your guys' product offering. And are you all tracking data, I'm assuming, on how many of those NPNs or brokers or producers kind of write both lines of business?
Absolutely. We look very closely at that. Yeah.
I'm curious, and I don't anticipate you'd have the numbers off the top of your head, but I always think in my mind, what percentage of these brokers actually write both lines of business?
What do you think?
I would, before he gives me probably a better answer, I think it's like a 20 to 25% range.
I was going to say exactly 20%.
So this data is a little older, but we once surveyed our active user agent base, and they said that 80% claimed to write Medicare. But when you dug down a level, only 40% actually had a contract with the carrier.
Okay.
And then within the ones who have a contract, ones who are actively writing is probably right around where you're.
So you mean agents lie or they exaggerate?
I would say they're optimists.
Yeah.
For sure.
So there's a couple of different, initiatives that you guys are focused on, really big. What are the priorities on the roadmap for you? I know I wanted to touch a little bit on, your foray into entering into the Medicare space as an enrollment platform, and then also ICHRA. But what do you have? What are your major initiatives?
Yes. So first and foremost, number one is just adapting to the changing rules and regulations and making sure that brokers have a step-by-step guide of, if we do lose enhanced subsidies, these are your members that are affected. How are they going to be affected? What are their options? And just click through and get them enrolled in a plan so that they stay covered, they stay in your book, so on and so forth. So priority number one is response to the changing rules and regulations and the potential loss of the enhanced subsidies. After that, we're building several new businesses, one of which is Medicare, as discussed, the other being ICHRA. Those have been what's really, so I like to say that, speaking to the sort of the experience as an entrepreneur, I kind of feel like an entrepreneurial kid in a candy store because we have a healthy, robust business in the ACA, and that means that there are certain businesses we can build that we're really, really uniquely positioned to build, and they're really fun to build, and there are ways to use the data that we collect in one context to support another context and vice versa. And so it's been a lot of fun to be like, what are all the things that we can do now that we are able, to service the ACA market so well that reinforce that core market and help agents and brokers in that market, and then also potentially other markets as well.
Yeah. I would say too, I would imagine there's some roadmap work with very specific projects with other carriers or payers, I would imagine you're working on. Again, going back into ICHRA and leaning into that, I think that ICHRA did not get as much attention as it should have in the last couple of years. And I'm looking forward and seeing, obviously new administration, new tone, but I actually, my prediction is that ICHRA is going to, double even this year and continue to snowball these next coming years. Is that kind of the path that you're seeing as well?
Yeah, so we actually saw ICHRA's double on our platform year over year. And what I'll say is we are big ICHRA fans in HealthSherpa, and we might have met our SVP, Mike Levine, who's working on ICHRA.
Yeah, we haven't met him yet, but we're anxious.
Yeah, and what you'll see is, what's shocking to me is how successful ICHRAs are in growing when the core employee and product experience is still so bad.
Yep.
And so just think if we fix the product, the employee experience, and if we improve the range of products that are available, like what potential that market has.
I mean, the family, the glitch kind of added some obviously other options. I think that was a great addition this last year. And yeah, same thing, especially those smaller groups, right? Like the very, very, very large.
Sub 50,
Yeah, when you're looking at those groups of 50 to 100, it is such a challenge for that employer to have such robust, rich benefits for that employee. And we have just seen that being such a big win for the consumer.
We'll talk more about ICRA, but I think it makes a lot of sense, So there's a model there where, I think it gives consumers more flexibility, more choice, more options, and the employer as well. And for agents out there listening, I think it's more available than selling small group or large group insurance as it is, because it's just almost a completely different side of the business. There's not as much of a roadmap into that space. It's almost, you don't see a lot of agents selling Medicare ACA right now that are also doing
leaning into ICRA and
large group and small group.
Yeah, doing those.
Where do you see the opportunity for the average agent out there?
So there's a lot, and it's an extension of the core sort of competence that agents already have, which is like figuring out an audience that they serve really well, right, and meeting those needs. In that pool, there will be people who are part of organizations, whether it's small employers or smaller groups, that you can basically offer this as an alternative to, right? Because at the end of the day, one of the things I hate about ICRAs is like we love the enthusiasm about ICRAs, but we want to temper expectations only because ICRAs, it's not fundamentally a technology problem. It is a relationship problem, right? It's not like we're figuring out how to, the technology to power this and that's how quickly the market will evolve. The market will evolve at benefits pace. And the thing about benefits is benefits people tend to move slowly in corporate context. And so I think the key there is that it's a relationship business, and that is what brokers excel at. That's the fundamental name of the film in being a broker. And so I think all of the opportunities for brokers to build those relationships with employers, with small groups, and to educate them into an eventual transition into the individual market via an. But for that to work, then the employee experience has to be really good. And that's why we're so focused on it.
Yeah, a couple of things I want to talk about, tech enhancements, things that I've even seen and witnessed even over the last 2 years. Been impressed with some of the agency features you guys have added in, making our lives a lot easier there, actually having that data. I mean, I think that there's a couple other enhancements. I don't know what you're able to talk about. I'm excited about the roadmap and knowing some of the things that are in the pipeline. But then I'm also seeing ease for us at scale when we're writing products in a lot of states. I obviously see a path where there's going to be a lot more private exchanges happening, state-run exchanges. Right now, that's always been a challenge for an agent who's writing in multiple states, right? Because they're using your platform on the FFM states, but then when they're selling those private exchange states, that the data and that customer information is in a completely different source. It's always a challenge. Certifications are a challenge. You guys obviously helped with the Georgia exchange this year too, and probably I want to hear about that and challenges, successes from it. And I would anticipate you guys seeing more of those state-based exchanges that you're going to be involved in.
Correct. And that is one of the opportunities, as we say, every change brings with it sort of risks and opportunities. One of the major opportunities I think that comes out of the proposed regulations that we have right now is that it will, I think, require a change in mindset on the behalf of the existing state-based exchanges, where historically they haven't really partnered as much with the broker channel, at least not by, again, enabling cross-state enrollment and so on, or management plan and so forth. And so historically, the SBMs have been about 70% passive enrollment. You look at Covered California, I think it's 25% $0 passives. So exactly those who are being targeted by this $5 premium. And so I think the historical approach of sort of the monolithic siloed approach that some of the states have taken, there's an opportunity to open that up and allow for entities like Agent Boost, for folks using our platform, to really operate in those markets and achieve those same efficiencies there.
Yeah, and we're hoping the same thing that you are probably, that, hey, when we understand that most of the business is actually moved by the broker, you get X amount of enrollments and coverage with your, I don't want to say constituents, but your residents there in those states. You're only going to have X amount of passive enrollment, but you get the broker community involved, and they're going to be doing valuable service in the community, and they're actually going to be driving those numbers up much more significantly.
I would go so far as to say that allowing brokers to, use ED type platforms in state-based exchanges is the largest growth opportunity in the ACA, right?
Correct. What do you see the appetite with a lot of these state-based exchanges and the DOIs there? Do you see, are they leery about working with HealthSherpa and growing broker EDE integration, or is there a pretty strong appetite from most of those states?
I would say there's a preference to do things in-house. And so I think the first thing that those states are going to do is, realistically, I think many of them will probably challenge the administration's new rules, possibly in court. But assuming that the proposals move forward as currently articulated, I would anticipate that they will first attempt to do outreach themselves via their own call centers. Now, the challenge there, which an agent intuitively understands, is you've got stale contact information 2-3 years old for a low-income consumer. Like, that's going to be it's going to be an uphill battle to get a hold of them that way.
Those Obama phones don't ring anymore.
Yes.
Yeah.
And so they're going to need to sort of see that in practice. The challenge is there,
Right.
Before they're, I think, more open to exploring alternatives. But we're sitting there and saying, look at what brokers were able to achieve in the federal marketplace in terms of just the amount of private sector investment, the number of folks who got covered. That is such a tremendous opportunity for the state-based exchanges.
I think one of their biggest concerns as well, those states, I'm sure mixed feelings, but one of the big concerns has been just a lot of the fraudulent behavior that's happened in the last couple of years. And a lot of those states were more cautious and a little bit more protective. And some of them had, mechanisms of like 2FA and different links and ways to make it a little bit more challenging to write the business in those states, but that also had the effect of limiting some of the fraud as well. So I think that I would imagine is one of their concerns as well. And as you guys are having conversations with those state-based exchange, I'm sure that's a big component of the conversation. Yeah.
It is. And what I would say, though, is interestingly, it's interesting to note that fraud hasn't gone away despite the last July's moves by CMS. And actually, even though those moves were targeted at reducing unauthorized plan switching, which would only theoretically affect existing enrollment, we actually, across the whole FFM, saw a 34% drop in new enrollment. So that's what happens, the unintended consequence of sort of disrupting the unit economics that brokers have,
Right.
Resulting in less investment and sort of like unwinding that sort of beneficial loop we had with brokers investing more, growing, and so on and so forth. And so one of our major concerns, to be frank, and I think this will benefit your sort of viewers, is that fraud has not been addressed. And right now what we're doing is we're addressing it at a regulatory or a legislative pace, which is a little bit like playing, slow motion sledgehammer, when really you need to be able to get in there quickly and efficiently. And so we have some proposals out for various mechanisms to sort of alter incentives to try and create like private sector regulatory functions, so that we can react more quickly to evolving fraud. Because the reality is there was a pretty big hit to the market last July.
Yep.
And it certainly addressed some UPS, but that fraud hasn't gone away and it's emerged in other formats. And we're starting to see it come through other channels. And that's a huge challenge.
Yeah, sure. I was going to ask you about what steps you're all taking to kind of get ahead of that, so to speak, because, what you're saying resonates with me so deeply because we're one of those impacted organizations where we say, hey, we could even grow a lot more significantly, but the challenge is, just the economics of it, right? Because of how many policies that you're writing legitimately, how many of those are actually not staying around. We'll just put it that way. And then when you're trying to run a business that way, just the economics aren't there, right? So that has been a challenge to scale that and grow that. I think that's similar to a lot of your, partners that are using the platform. So yeah, just kind of maybe an insight on things that are happening right now to maybe enhance or change that.
Sure. So there's two categories. There's what I would call sort of reactive and proactive. So on a reactive basis, we actually operate an internal fraud prevention unit, which with 12 people in it. That's actually not required by anybody. You do that purely because we want to protect the market. And they go out and investigate complaints, and they go and look for patterns, and they share information, and they try and sort of address fraud that has already occurred. And then there are the proactive initiatives, where it's us going out to carriers and to major stakeholders and saying, can we collaborate in order to address the issue of fraud in our industry? And, this is, I'll just share the context briefly, but fraud is not new to insurance. It's just newer to ACA because the ACA is newer. So a classic example is in the early 1980s, you had property and casualty. People would they'd have a Rolex and they'd take out 4 policies on it. They'd destroy the watch and file claims against all 4 carriers. But the carriers pretty quickly figured out that we have fraudsters at work here. And the only way to address that fraud is by overcoming the information asymmetry that exists. And so they created what's called a participatory data exchange to compare notes, identify fraud, and keep those people out of the market. So basically, if you defraud one carrier, every other carrier knows about it and doesn't work with you in the future. So we've been working to assemble something like that in the ACA as well. Because right now, one of the problems is because of the lack of transparency, it's very easy for someone to commit fraud with one carrier, go do it to someone else, use a different NPN, start switching, and then it's hard to chase. And so we think to overcome that, you have to share information.
So are you talking about maybe rebooting or like a new iteration of the MDN, the Member Defense Network, that we talked about last year, or is that?
Yes.
Which we were a part of, by the way. How
yes.
did you do that?
So
that was like, and we're ready to go, and they tried to solve it themselves.
Yeah. We got very, very close.
Yeah.
And I will say, just speaking transparently, at HealthSherpa, there's a little bit of sort of heartburn about MDN because of we worked so hard on that and got so close. We had 2/3 of the market committed and ready to go, and then CMS drops the hammer. But understanding why they had to do that. But the thing is, again, the fraud hasn't actually gone away yet.
Correct.
That's very important.
We talk about it a lot. I mean, we've just had people calling in from certain call centers like, oh, the name is a female, this person's calling in, purporting to be that individual, and a lot of the fraudulent activity is unfortunately still happening.
Where do you feel, because people have been critical of brokers, they're critical of CMS, they've been critical of HealthSherpa. What do you feel like your role with HealthSherpa is in, obviously it's in our mutual best interest to all band together and root out the fraud, right? What do you feel HealthSherpa's role and responsibility is in fraud?
So I think that's why we've been, between MDN and some of our other initiatives, because of the role we play in the industry and the amount of enrollment we process, we think if anyone's going to be proactive about it and go and craft a new solution, we will do that sort of collectively on everyone's behalf. But it is, it's a major investment. And we see ourselves as getting out a little bit, putting ourselves out there a bit, investing a lot of our own resources into it to really try and solve this problem for everyone. And it creates challenges because at the end of the day, we are a business, right? And so it'd be the easiest thing in the world to sort of ban everyone who sort of looks sideways at us, but then all of those folks would, migrate to other platforms and we wouldn't have much of a business left. So there's this balancing act you have to play there. And that's why we're working so hard on coordination efforts, getting everyone to contribute and work together on this.
Well, and I would imagine that obviously you guys are just the enrollment platform, right? You're just the exchange there. So, I mean, obviously you guys have data points, and I'm sure, like you said, you collaborate and share with carrier partners, and you can see certain activities where patterns are created within the system, and it can obviously say oh, this is odd. Huh. This person's their AOR has been changed 57 times in a month. Huh. This is a little weird. I mean, so you have that data that I'm sure you can share with carriers, but beyond that, you don't have the ability to take it 2 or 3 layers deeper and actually do something punitive about it, so to speak.
Well, we can ban, and we can and do ban people from our platform. And actually, we've gotten in trouble for that in the past, that we've been too aggressive with our bans. And that's created some interesting legal questions as to, whether we have the authority to ban people unilaterally, which we believe we do because we're a private company. Right? But I will say some of the new CMS measures, particularly the reliance on the 3-way call, has actually made it harder for us to do fraud prevention because we lose visibility into that final step.
Correct. And we've talked about it on our own podcast before, and we know of and have heard calls of people pretending to be the beneficiary. And like you said, the fraud is still continuing. It's just in a different form or fashion. And so we really need to, together as an industry, with the help of CMS and platforms like you, root out, some of these larger networks that have been doing it.
Well, I think it's about addressing the incentives and basically making it so that you commit fraud once, you lose the ability to get paid pretty quickly. And so then, you cut it off at the start of the process and not 6 months, 12 months later via a very heavy-handed regulation that also takes out a whole bunch of new enrollment.
Yep. I don't want to dwell on talking about fraud too long. That's like a downer. It's not a very exciting episode to be talking about the fraud. And,
well, that's what agents would.
And I feel like we've talked about it ad nauseum, right? I mean, it's just been a very recurring theme for the last year or two. So I want to focus as the optimist and the sales guy here, and let's talk about brighter days ahead, because I really do think that there have been some changes implemented that are starting to improve things, and I am still very bullish on ACA if I look forward in 2026 and in 2027. It's very short term. Share with us, if you can and what you can, about maybe like roadmap or what things look like, things that you're seeing or predicting in the near term that you're able to talk about.
So I think in the near term, there will be, depending on which combination of what happens with the expanded subsidies, right? If they're extended, if they're sort of held in place for a year, if they're adapted.
Optimistic on that, by the way.
Um,
Interestingly,
I'd say, yeah.
I'm optimistic. Because
I think they're going to meet in the middle.
It's my bold take. I don't know.
There's cause for optimism, which is, I mean, there are a lot of constituents and a lot of different constituencies that are affected by the loss of those expanded subsidies. I think the nuance is that there needs to be I think most people tend to agree north of 400% FPL should probably not be subsidized. But
Agreed.
Maintaining the expanded subsidies sort of further down the curve makes sense. And then the math of how you do that, and crucially how you pay for it, is something that is work that Congress needs to do. And unfortunately, Jeff Grant mentioned this yesterday on the panel, Congress isn't currently doing that work, but I think there's going to be enough pressure on them to do something that, like, there should be some sort of compromise solution that allows the people who most need those expanded subsidies to retain them.
So let's say for a moment, pessimistically, subsidies don't get enhanced. What does it look like?
So it's important to, our earlier discussion, it's important to look at the whole story. And so we call this the quadruple whammy at HealthSherpa. So whammy 1 was Medicaid unwinding sort of wrapping up. 2 was last July's CMS sort of anti-fraud moves that had a sort of a ripple effect.
That was a surprise to us.
Yep. Whammy 3 is these program integrity rules that we're looking at right now, and 4 will be the loss of the subsidies. And so, depending on if all 4 of those play out as they currently do, that I think would have a pretty substantial near-term effect on enrollment volumes. But that is not to say that it's it will be catastrophic in the market. It will be an adjustment, and it will present some challenges. But I think the best entities, the best brokers, the people who are focused on this business should do it well. There maybe less excess, but there will be still opportunities to do business and to grow and to build a healthy business.
Very good. And from and this reveal what you can. But is there anything from a product perspective right now on your platform that is not necessarily a problem that you're trying to solve, but something you're trying to enhance or improve right now? Anything like exciting from that side of the house that you're able to share?
There is a great deal that's in the pipe. And it's challenging because, again, the point about not wanting to share things before they're fully baked. But there are specific things we're doing to really, one, address how an agent operates effectively in the new world, right? Once the new rules take effect or expanded subsidies go away, we want to make sure, like for brokers, that is as seamless as possible and they're as productive as possible. And then there are other sort of long-standing fundamental challenges brokers have with managing their books, with interfacing with carriers, with understanding the status of their policies, that we're taking very high-cost, long-term strategic investments to address these fundamental problems. And as you start to see some of those pay off, our hope is that brokers will just immediately experience the benefits, because there's things you just there's no easy way to get there, but it's so valuable, it's worth spending the 3 to 5 years and gosh knows how many millions of dollars to get there, right? Because it's the right thing to do, and it's going to matter at the end of the day to the broker who's using the platform.
Yeah, and I would say I really appreciate that too. I mean, we felt like we've had somewhat of a sounding board with your team as well, and saying them coming to us very constructively to say, hey, your hands are in the dirt, so to speak. Like, you guys are in the business. Like, which of these initiatives do you rank or prioritize as being the most valuable? We only have so much dollars bandwidth, deliverables this quarter or next year. Do we prioritize this project or that project? So I would say very commendable about how nimble they are and how they involve us in the process.
Well, I would turn that around and say thank you to you and the other brokers who take the time to help us do that, because it is invaluable to us. We quite literally, we wouldn't know what to do without that feedback. And so getting that clear and unfiltered and totally fine for it to be constructive, right? We can take negative feedback. That's fine. That stuff is hugely appreciated. I will say, I don't know if you noticed on our site, there's a little feedback widget. If it comes from an agent, I actually read every single piece of feedback an agent submits. And let me tell you, some of them are hilarious. I think there was one thing that was just F you. But then there's also lots of like positive. And actually, funnily, whenever there's negative, like I email them and I'm like, hey, could you expand?
Hey, yeah, please.
You're like,
tell
I'm
me
not the
details.
CEO.
Yes.
I received that message personally. Could you expand?
Let me know what you meant by that.
Right.
What were you feeling in the moment?
Yeah, I feel that on my Google reviews sometimes as well. You know, like, okay, thanks for that feedback. Very, very helpful.
Yeah, we've been working with your team on the Medicare side of things. How do you? We see the vision, right? We see the vision of the life cycle of a customer and an agent being able to have that data and enroll them on a U65
the journey.
product, and then as they're turning 65, have that data there to seamlessly process that enrollment. Talk about like what your goals and what your hopes are for the Medicare enrollment side of things.
Yeah. So, stepping way back, if you think about it, in this country, we have 3 different systems in which the same ultimate payer, taxpayer, is paying the same intermediaries, the carriers, on behalf of like slightly different flavors of the same consumers, whether they're over or under 65, higher or lower income, right? Medicaid, Marketplace, Medicare. It's all the same set of cast of characters, just under completely different sets of regulations. And so that results in huge inefficiency, right? Like turning 65 shouldn't be some kind of dramatic life change where you have to change doctors, you have to worry if your prescriptions are covered, you have to like all these things. It should be as seamless as possible. And so we see our role as, we fundamentally think of what we do as like infrastructure and technology, like plumbing, right? We do technology plumbing. And so it's just create the technology that makes that a much more seamless transition, both for the member, but also for their broker who's trying to help them, right? And so we're very excited about just like taking the 500,000 people a year in our platform who are aging in and just making it really, really easy to take their doctors, their demographics, their drugs, and just get them in the right plan. And everyone's happier. It's more efficient. The broker is more efficient. They're making more money. The member gets the plan they want. They get it quickly. The carrier doesn't have to freak out about losing membership and friction. And so there's just so much low-hanging fruit there.
Those are big numbers, 500,000 aging in, massive. What would a successful year look like for you guys? And not just from a numbers perspective, but when you kind of sketch out the year, what does a successful year look like for you?
Executing on company goals.
In Medicare specifically or broadly?
Broadly.
Yeah. So I'd say broadly, it's meeting the challenge of helping agents adapt to the new rules and making that as seamless as possible. If people are happy with us, as happy or happier than they are with us now, after that transition has occurred, then they say, you know what, there were challenges, but you really helped us through this. That is like far and away the number one success method. Then our new initiatives, Medicare, ICRAs, et cetera, they've set very modest goals for themselves. They only want to grow 10x. So
that's it.
Yeah.
Only 10x.
So I was like, I asked them, they're like, yeah, we're going to grow 10x. I was like, if you grow 5x, we'll still be pretty happy, right? They're like, no, it's 10. I'm like, okay. So if you see some of that, growth in some of those new initiatives.
Love it. I can relate to that. Well, before we wrap, any last thoughts, Mike, before we wrap it up with George?
Yeah, I kind of wanted to, I lost my train of thought there at the very end, but I kind of wanted to loop back to, with the CMS right now, you have to do the 3-way call, right? What solution, I don't see that sustaining, right? If you listen to what's happening at Health and Human Services and the layoffs, once Oz gets in and, possibly Elon gets the keys to the front door of CMS as well, I would imagine that there are probably going to be some rifts and some reduction in headcount there as well. I can't imagine a world where we continue on with the 3-way calls there. Does HealthSherpa already have a fairly immediate solution that would be satisfactory there that you guys have ready to go?
Yes, we've got a number. We actually have we've shared a list of 10 different ideas for how to address fraud in other ways, right? And some are incremental, some are just like a pull it out completely. But we have, there are very direct paths to just avoid the 3-way. The 3-way call is horribly inefficient.
Just presenting resume link to function again.
Correct. Yeah. As a simple example, that's one of the 10, right? And so, because the 3-way call is horribly inefficient. It takes a ton of time. And to your point, during peak times, you can have wait times, which makes it even worse. And
it's not it's fraud still.
There's no actual identity verification occurring. And so fraud can, come right through that mechanism. And so it's sort of like the worst of all worlds. And I want to say, I understand in the moment what CMS was trying to accomplish. And there were certain pressures that resulted in that outcome. But is that the long-term sustainable solution? Absolutely.
Yeah, and there's got to be some other identifiable pieces of information too, because whatever system that CMS has been using to identity verify,
I
there's
think it's Experian or
mismatch a lot of that. It's like they ask you those questions. What was the name of how much was your car payment back in 1997? And people can't remember it, or there's a lot of ID matching, or people that came in with an ITIN, they don't match up. It's just very inefficient.
Well, the big challenge there is actually it's based off credit history, and a lot of low-income consumers don't have credit histories. So there are much better identity proofing mechanisms. We've actually launched a number on our platform recently. We've launched one new identity proofing mechanism. It's driver's license based.
Yes, I knew that was going to happen last year, and it's ready to go.
It's live. Yep.
Great.
And then there's another one coming down the pipe as well. And so alternatives there. Like what people traditionally call two-factor, like the SMS, is a partial solution. The challenge there is that it's easily gameable, and there's other you can rent a number to text from for $2 a month, and so you can spin up numbers like that. And you want to be careful about tying consumers to a specific cell phone number, because low-income consumers will not pay their bills. The number will get released. They'll lose access to it. Or if you let a fraudster put that number in on their behalf, and they now control that person's access forever.
Wild, right? Yeah. That is wild.
And that's what I mean about there's no silver bullet approach. It's got to be a really sophisticated, because fraudsters are sophisticated. So the response has to be sophisticated and rapid, and that's why we're so focused on let the private sector fix it versus playing regulatory whack-a-mole with a sledgehammer, waiting 6 to 12 months before you take action.
Yeah, and I think that was one of the challenges that we faced too with some of those quick pivots and reactions from CMS, which, from our perspective, we understood it. I mean, they wanted to act quickly, but the supply chain ecosystem, I mean, a little heads up would be nice, kind of hey, just heads up in 30 days, we're putting out a letter. Here's a notice that in a month, this is what's going to happen. It would be nice. I get that, that's going to tip off the fraudsters, so we don't want to give them a head start or let them react. But at the same time, the good actors have absolutely no time to react. Suddenly, it's it's a Friday, and their Zoom links don't work, or it's a Friday and it's a 3-way calls implemented. And we're like, what just happened?
And if it's any consolation, we were completely in the dark as well.
Yeah. I've frequently think, man, this is really difficult for us. I wonder what it's like for HealthSherpa. I honestly think that fairly frequently.
And I'm also I'm fairly smart, every once in a while, I'm not the smartest guy, but we're pretty sophisticated, and we're this is really freaking hard.
Yeah.
So.
Yeah, there's complex challenges in the industry. Maybe, looking back into the real estate side, it looks like you still made the right. It's been difficult, but you still made the right choice because
you were quicker to market than Zillow and Redfin. Come on.
Well, yeah, and all the same woes that we have kind of played out on the real estate side of things with tech disruption and regulation, and just as well. So no matter what path it would have taken, you would have been dealing with similar issues, right? That's the life of an entrepreneur.
I think that's fair. Yeah.
Yeah.
So, hey, really appreciate it. We know your time is very valuable, so appreciate your generosity with your time, and we're big fans of HealthSherpa and your team. You built an excellent team.
Well, I'd say thank you so much for having me on. I really appreciate the conversation and what you folks are doing.
All right.
Thank you so much.
Thank you very much, George.
Thanks, guys.
Thanks, guys. We're out for Medicarians. That's true.